Hi everyone, I'm Pallavi. I'm a podcast host and also a content creator. I have two dignitaries with me today. Let me introduce you to them. I have Dr. Topoti Mukherjee, who is the lead consultant nephrology and kidney transplant. And I have Dr. Kristin George with me, who is the consultant nephrology and renal transplant.
Thank you.
Thank
Our
you.
pleasure.
Pleasure to be here.
We are living at a time where alcohol and coffee are considered to be personality, whereas hydration is considered to be a lifestyle flex. Well, we have with us two kidney experts who can actually decode and let us know what is actually keeping us running. Is it caffeine? Is it water? Well, doctors, my first question for you would be, what is the one everyday habit that you want to diminish and remove from people in order to have a kidney which is healthy?
Now, when your aware should be a little thoughtful awareness. It should not be obsessed or overcome by fear. Now, the awareness should definitely focus a lot on your own lifestyle, a healthy lifestyle. Things like caffeine, alcohol, as you said, they define a personality. Alcohol within the defined prescription is actually it's permissible. Coffee also, so long as you're not exceeding which to a certain limit which can cause things like acidity or sleep problems. I think that is also fair. So at some point we have to listen to our body. Now, regarding hydration, it's always good to be well hydrated and drink water. But here again, we need not go overboard with our water intake. We need not be obsessed. There are, I in my own practice, I see people drinking 6 liters of water in a day, 7 liters of water in a day. They wake up in the morning and just drink 3 liters of water. That is really not required. Our body has sensors. It has thirst sensors. It tells us when we need to drink water. And that drinking water that is commensurate, a volume that is commensurate with your thirst should be enough. So we have to take things as they are. Do not overdo anything, and there's no need to underdo anything.
Right.
That's the mantra.
Right. So, just to reiterate what you were mentioning, doctor, about the amount of water that has to be intake. So, I want to let the audience know this discussion is going to be very interesting because we are going to focus on real things about kidney. We are not going to talk about fancy sipper bottles or some way of making tongue tantalizing, specially crafted detox beverages, which is actually these days people are claiming it's helping them boost or meet their hydration goals. We are going to go real about our kidney health in this urban world. So, doctor, about the sedentary lifestyle and also the hustle culture prevailing in most of the urban cities like Bengaluru, for example, what do you think, what effect cortisol or what effect does this sedentary lifestyle of not working out is having in our kidney health?
Right. I think Dr. Topoti has very nicely, summarized the key factors with respect to the rising incidence of kidney disease that we are seeing. So, the lifestyle diseases of diabetes, hypertension, and obesity is increasing by leaps and bounds. And many a times, kidney disease is a byproduct of these metabolic syndromes itself. And as we know, the hustle culture or the stress levels that both in the professional as well as the personal space that every day we all are going through does have, if not a direct, definitely an indirect effect on the kidney health. So if I may little more explain in detail, one would be the cortisol, which is a stress hormone in our body. So the cortisol levels, when it shoots up, it can cause your BP to go up. And when there is recurrent surges in cortisol hormone, it does cause high blood pressure and the changes of that.
You're mentioning that it's also genetically something to do, not just lifestyle alone.
Yes, we all have different genes, and we are all genetically predisposed, or sometimes if you're lucky, genetically protected against certain diseases. So when talking about kidney, there's something called nephron endowment. So like how your height, weight, skin color, everything, there's a spectrum in the population. Even in terms of the number of nephrons are the functional unit of the kidney. uh, Average each kidney you have about 1 million of these, but again it varies from person to person. So the number of nephrons you are born with will give you the reserve in kidney function.
What do you think that how much impact this high sodium food or eating outside junk food has to do with the kidney health?
High sodium intake has a huge impact
Okay.
on the kidney health because it is directly related to the risk of hypertension.
Mhm.
And hypertension is one of the commonest factors for causing kidney disease. In fact, the most common reasons for people entering a dialysis program is diabetes followed by hypertension. It's as common as that.
Okay.
Now, a person with normal kidney functions, if we take a diet that is rich in salt, within 24 hours, within the first 4 hours, almost 50% of that salt is excreted by the body, and in the next subsequent 20 hours, the remaining salt is excreted. Now, beyond the kidney also has a threshold. Beyond a certain point, we may exceed that threshold, and if it is a repetitive culture of eating a very high salt diet, it is not good for the kidneys. Having a low salt diet is healthy from many points of view.
So, doctor, like for an average adult, what is the safe dosage or threshold that you mentioned about the sodium intake?
Around 5 grams should be okay. Little bit here and there is acceptable. 5
Okay.
grams of salt in a day.
Okay.
1
And,
gram is
yeah.
around 1 pinch.
And as we touched upon coffee also earlier, if you could just help us to know that what is the dosage or the threshold?
There is no dosage as such. No.
Okay. And it has a sleep cycle that it impacts, right? So you cannot have coffee right before sleeping, or is it advised?
That is what
depends on
is
person to
advisable.
person.
Every individual has a different sleep pattern also. So people who do have sleep problems, the doctors do advise, do not avoid coffee after 4 p.m. or 5 p.m. People do advise that, yeah.
And regarding RO water, that most of the urban cities, people are having RO water. So the minerals are reduced in it. Do you think that might cause some chronic kidney disease in the longer run?
Should not, or maybe we are not aware, but RO water, from a point of view of hygiene, it is recommended. Now, in the process, if some minerals are lost, I think we get it back from our diet. If we have a balanced diet, we really need not worry much about that. Because cleanliness of water also matters.
If I may ask you that, the vegan diet, which is becoming very popular these days, it is very high in oxalate, right? These milk alternatives. So how is it related? Like, what is the correlation between high oxalate food and our kidney functions?
Right. So oxalate is present in a lot of food items, and some of the food, since you mentioned the alternate, vegan milk, like especially the almond milk, it's very high in oxalate. As opposed to this, when you're drinking, let's say a glass of almond milk, which has a lot of oxalate, a lot of it can directly get absorbed into your system. Now, oxalate, it is filtered by the kidneys and it has to be excreted in the urine. So if a large amount of oxalate comes out into urine, plus there is let's say some dehydration, or your urine is concentrated, there are high chances of it precipitating as crystal in your urine. And
You mean kidney stones?
yes. So this can itself deposit in the kidney, or it can crystallize and form a stone which can block the track.
I think with open source, Google, ChatGPT, I think everyone is going through a self prescription. It could be painkillers, it could be medicines.
Even patients with normal kidney functions, I'm really worried to prescribe a strong painkiller. So painkillers, they are very notorious to cause kidney damage in various scenarios. They can cause kidney damage in an acute setting, which is by and large reversible. They can cause kidney damage in a chronic setting. In addition, they can also cause some kind of an allergic reaction to the kidneys, which is again self-limited. Once we stop the pain medicine, the offending drug, it is self-limited, it recovers. But painkillers can cause damage in various ways. So they basically, if the kidney has several filters which are called nephrons, they act at a level where they directly impact the filtration capacity of the kidney. So they can harm the kidneys in several ways. So we definitely advise against abuse of painkillers. Many young girls, for their menstrual pains, they do take painkillers, which also should be avoided. As nephrologists, we recommend simple paracetamol as a pain management.
The another question is, doctor, this level 2 and level 3 chronic kidney diseases.
You mean stage 1, stage 2, stage 3?
Stage 2, stage 3. Can these be reversed through lifestyle changes, medication?
Yeah. So when we talk about chronic kidney disease, by definition of chronic kidney disease, there is an element of irreversibility. So as we were discussing, there is an acute kidney injury and then there is a chronic kidney disease. When it is acute, it can completely reverse. So when we talk about chronic, there is definitely an element of irreversibility. But having said that, we can significantly alter the trajectory of the disease by various medical lines of management, lifestyle changes. All this can halt the progression significantly. If you don't do anything, the disease is going to progress rapidly. So reversibility may not be in a setting of chronic kidney disease. Again, there are situations wherein an acute component can be superimposed on a chronic. A patient of chronic kidney disease may have an added insult, can come with an acute worsening. So that acute component can be reversed. Okay, but by and large, the chronic disease is not completely reversible, but significantly we can change the trajectory of the disease by treatment and lifestyle changes.
And post renal surgery recovery, what is the lifestyle changes that you suggest?
So kidney transplant is done in end stage kidney disease, and post renal transplant, it's very imperative that they take their medications regularly. Lifestyle basically focuses on a healthy lifestyle. Many of the dietary restrictions that are present in the previous and before prior to transplant, that is on dialysis, is many of those dietary restrictions are released, and some of them are even reversed. So the diet after transplant is practically a normal diet with specific focus on hygiene and lifestyle changes in terms of weight gain, healthy diet, what we know as healthy. We should a healthy diet, less caloric diet, low GI index, those things we focus on, because many patients become diabetics after a transplant.
Do they have to come to doctors?
Very regularly, they need to come, they need
For the
to do their,
checkups.
So life after transplant is near normal, almost normal if the kidney functions are good. Diet is also normal, but they need to understand that each one of us has to focus on a healthy diet, because compared to a person who has not had CKD, who has not undergone transplant, the risk of weight gain and the problems associated with weight gain are higher in a transplant recipient. So, and even infections are higher. So specific focus on hygiene and healthy lifestyle. This is the diet. And yes, we do encourage them to exercise. They should not be having a sedentary lifestyle. Smoking is a big no-no. So moderation of alcohol, these things have to be incorporated in the lifestyle.
And in urban city like in Bengaluru, what are the common cases that you see? Is it pollution? Is it work culture? What is the main reason that you are understanding by your experience that people are coming with their kidney malfunctioning or disorder? What is the common reason, and what are the common symptoms that they are complaining of?
Commonest reason still remains diabetes, followed by hypertension, followed by certain glomerular diseases and certain urological or structural abnormalities. Pollution, whether it's directly related, it's hard to say. There's not much data, but yeah, pollution, if you say indirectly, it can cause inflammatory stress, oxidative stress in the body.
So when we talk about screening, doctor, is it like an annual screening, which is something that people should be doing?
People with low risk, annual screening, yes, and people who are at high risk, as decided by the doctor, how it may be a little more
This
frequent.
will help in keeping them to
early detection.
Pick it up early, yes. Pick it
Early
up early.
detection matters, yeah.
I'm sorry to say that even in a city like Bangalore, we often see patients coming to us who have been suffering from diabetes for years together, coming to us for the first time with very advanced and irreversible kidney disease because of diabetes, and they have never once got their kidneys checked. These people should know that kidney diseases are silent, and diabetes, hypertension, even if you're taking medications, still can damage your kidneys.
So, doctor, with the increasing fitness enthusiast consuming a lot of whey protein, maybe collagen, so what do you think it has to, the correlation it has with the kidney functionality?
So when you take these creatine supplement, it is broken down into the creatinine, which we are actually going to measure in the blood as an indirect measurement of your kidney function. So naturally, the byproduct also shows as an elevated value. Now, that need not always mean you have a kidney disease. That is point number one, when you are on a supplement. But having said that, taking in large quantity along with large quantity protein,
And
especially prolonged time, especially when you are, relatively dehydrated, can again put a stress on the kidney. Kidney can go into something we call hyperfiltration. The kidneys are pushed to work harder. And if it happens over a long period of time, as you rightly pointed out, it can lead to kidney damage.
So we have protein supplements and also natural sources of protein. So does the natural source of protein also the same gram, the same dosage, will it cause that same adverse effect that as compared to the whey protein?
Right. So a protein concentrate is in a small volume. There is a lot of, as
Right.
opposed to a dietary protein, which also has fiber, which also has other components, wherein the,
Carbohydrates.
yes, carbohydrates, wherein the absorption is more slower. You do a workout, you drink a protein drink, which has, let's say, 40 grams of protein.
Right.
You know that 40 gram is entering your system directly. And of course, after a workout, you're sweating, you're dehydrated, and that amount of protein when the kidneys, it is directly hitting the kidney.
Stress for the kidney.
Yes, yes.
And also it has become a culture, it has become a trend these days to consume energy drinks. Basically it also says that 0 calorie energy drinks that are coming in the market, so people think it's, it's safe, it's giving you some, it's not alcohol, and you're having instant boost of energy. So how adverse are these to the kidneys in a longer run?
We are on a balanced diet, we are hydrating ourselves uh, adequately, we do not need them. Now some of the energy drinks may be having a very high concentration of certain minerals, and minerals, and which we do not need. Like over time one would overwhelm the capacity. So as Dr. Christine also mentioned, that there is something called as nephron endowment at birth, which we do not know. So we do not know whether the minerals, the dose of minerals would overwhelm the absorptive and reabsorptive capacity of the kidneys, because kidneys are working at a very rapid pace and they are working constantly. So we do not want anything to overwhelm that threshold.
There are health trackers these days which people are using to remind them of their water intake. Do you think that is helpful some way?
So we do not need a health tracker to tell us we are thirsty. Now, extremes of age or people who are, say, in an ICU for a long period, who do not have access to water or who are unable to communicate their requirement for water, those are situations where we actually see electrolyte disbalances in terms of sodium. Our body, a normal functioning body, has a tremendous capacity to sense. Like even I know right now as I'm speaking, I'm feeling thirsty, but right now I do not have immediate access to water, so I'm not drinking. But maybe in 5 minutes from now I will drink moment so we have that capacity to, we have thirst sensors in our body which is very accurate and which senses our thirst requirement.
What are the situations or conditions wherein you have to ask to restrict
Patients
water?
who have advanced kidney disease are fluid overloaded, with who are also, many of them who are also compounded by a heart ailment, sometimes heart failure. We have to restrict water because their lungs will not be able to, they get overloaded, and the kidneys do not have the capacity to excrete all the salt and water load. So those are situations where we have to restrict water. So reminders, if at all, are required for those patients for whom water can be very harmful, and they have to keep giving them auto suggestions to restrict their water.
Before we finish, do you want to, I'll ask doctor to please go ahead and give some concluding statements for the audience.
Thank you, Pallavi, for doing this conversation. I also enjoyed imparting my few nuggets of wisdom. If I were to give a piece of suggestion to my patients, it would be just be aware, be alert that kidney disease is very common, is rapidly increasing. At the same time, try to understand the body, how the kidneys function. At the same time, I would also say that as an encouraging point of from an encouraging point of view, I would say that the outcomes of kidney disease has improved over the last few years and decades. So there's nothing to be very upset. Also, if you have kidney disease, there is a lot to look forward to. There is a lot of good life to look forward to. Just focus on certain simple things which can help all of us a long way in preventing or slowing down kidney damage.
Thank you so
Thank
much,
you.
doctor.
Thank you.
And Dr. Kristin.
Thank you, Pallavi, for a wonderful conversation. I would like to conclude by saying that kidney diseases are silent killers. Prevention is definitely the most important thing, which we have
The
largely
screening part,
discussed.
yeah.
And second is early detection. So if you have a disease of kidney, please come to us at the early stage, wherein we can make the maximum impact in changing the course of the disease. Previously, people used to think that kidney disease is no treatment, and they would go to a lot of these alternative therapies, and so that's no longer the case. We do have therapies depending on what stage of kidney disease you are. Don't be disheartened. we are all there to help you.
Thank you so much to both of you. We had an amazing time knowing from the kidney experts what actually matters and breaking all the myths that we knew. Thank you so much.
Thank you.
Thank you.